Hello, and welcome to the sixth and final episode in our series on Ayurveda in mental health and neuroscience. In the previous episode, we understood some of the fundamental concepts related to Ayurvedic principles in neurological disorders. What are the important neurological disorders according to Ayurveda? What are the underlying factors? And what are the symptoms and how they are diagnosed? In this episode, we will try to focus a little bit on how neurological disorders could be managed according to Ayurveda. Come, let us meet our expert.
The main treatment principles in Ayurveda for neurological disorders is broadly classified into two based on the pathology. As described earlier, when a disease is caused due to the diminution or degeneration, the line of treatment that is being applied is various panchakarma procedures or the biopurificatory measures like snehana, which is called as oleation therapy, svedana, which is sedation therapy, virechana, therapeutically induced purgation, basti, therapeutically administered enema, and there are few other external therapies which are mainly indicated. And when it comes to that of the impedance, that is a pathology caused by due to the impedance, initially rukshana or the drying therapy is applied to the patient in order to clear the channels of the circulations of vata, and then the earlier said treatments are applied to the patient. Individual neurological disorders in Ayurveda are treated based upon the site of involvement, the cause, the causative factor behind the causation of that disease, and the nature of the symptoms. So, for example, if it is a site that is involvement of one limb, so then the various Ayurveda treatments like the oleation therapy, sedation therapy is applied to that particular limb. If it is a half side of the body, then the same therapy is applied to the half side of the body. And when the involvement is the whole body, then the therapy is applied to the whole body along with certain measures which alleviate vata, like therapeutically induced purgation and therapeutically administered the enema are extensively used. So there are specific herbs that are mentioned in Ayurveda. So when we come to the medicines that are being used to treat various neurological disorders, there are herbs and also the mineral products that are being told. So when we come to that of various type of herbs, especially herbs like rasna, that is Lucia planciolata, ashwagandha, the lashuna, that is Allium cepa, all these are being used. And when it comes to that of the mineral products, it is being used in the form of bhasmas, which is, these are the metals which are metallurgically incinerated and converted into ash. All these medicines or the herbs and mineral drugs are used in the preparation of various oils, various herbal tablets, various herbo-mineral preparations, and these are administered externally where they are used for therapeutic massage, and they are administered internally in the form of the medicated enemas and also through the nasal instillations. There are non-pharmacological methods for treating the neurological disorders. These are basically come under the aspect of preventions, where the patient is told to follow the proper the daily regimes, the seasonal regimes, and also to follow the proper codes and conducts, where an individual, when they adhere to these type of principles, they also act in prevention, where prevention is also an aspect in the curation of the neurological disorders. We can integrate the Ayurveda principles along with the modern principles to aid a comprehensive treatment of neurological disorders. Like for example, currently we are managing the post-stroke conditions, the conditions of cerebrovascular accidents which have been acutely managed by modern medicines, and they have been admitted in Ayurveda section for better motor recovery. So these patients are finding the better motor recovery, they are improving in activities of daily living, and their quality of life is also improving. The similar thing also we are seeing where where Ayurveda principles have been incorporated into the neurodegenerative disorders, where the post-acute management through plasmapheresis or IVAG, the patients have been admitted and treated for better motor recovery, and to see and we have seen improvement in the activities of daily living and quality of life. Currently, NIMHANS is giving Ayurveda services under the Department of Integrative Medicine. So currently we are running OPD weekly 3 days on Monday, Thursday and Friday, and we have an exclusively 30-bedded IPD facility where we have 18 general ward beds and 12 special ward beds. We have 10 panchakarmas with 10 trained therapists, where all the exclusively different panchakarma procedures have been conducted. So under the Department of Integrative Medicine, we are exclusively giving the neurological services. Apart from that, there are various Ayurveda colleges which have been set up throughout Karnataka and throughout India, and there are special centers which have been established by the Central Council for Research in Ayurveda and across India. So where the service of Ayurveda for various neurological disorders are available.
This concludes the sixth and final episode in our series on Ayurveda and in mental health and neuroscience. This episode gave a lot of details about the managed and therapies available for neurological disorders according to Ayurveda. This included pharmacological and non-pharmacological approaches, how to integrate modern medicine principles with Ayurvedic principles in treating neurological disorders, and where we have facilities available for Ayurvedic treatment of neurological disorders. This concludes the 6-episode series on Ayurveda in mental health and neurosciences. We exhaustively covered different aspects of Ayurveda, principles of physical and mental health according to Ayurveda, various mental health disorders, their symptoms, treatment and management. Then we went on to neurological disorders, their symptoms, treatment and other aspects of neurological disorders. Thanks for watching this series. Namaste.